Bismillah, alhamdulillah, wassalatu wassalamu rasulillah, rabbi shrah li sadri wa yassir li amri wa hlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. Today I want to talk a little bit about and discuss recovery journey from addiction, and just discuss and reflect on patients that I have treated over the years, and more recently the narratives of the journeys, the stories of people, which has really, subhanAllah, impacted me. I think the first thing to say is obviously patients who have substance use disorder, many of them are stigmatized by society, by their families, and even within the healthcare system, which is something that I'm very passionate about in terms of advocating for patients affected with substance use disorder. Many people don't know that it is a brain disease, and the reward hormone dopamine is the one which basically floods the reward system in the brain when somebody uses a drug or drugs, and this causes intense craving and leads to people neglecting family, work, hobbies, in search of that high, that dopamine surge that they get with drugs. And subhanAllah, the patients I have treated, a lot of them are extremely intelligent and articulate, come from professional backgrounds, started using substance for a variety of reasons. A lot of the time it's introduced by friends or family, and they go down a very dark hole very quickly. And when they get admitted for detox or withdrawal management, they have an opportunity to heal both in terms of their brain and also psychologically. And we do a lot of psychosocial interventions, talking therapies, social interventions, get to know patients on a personal level, and really hear their journeys. And subhanAllah, a lot of them are, like I mentioned, extremely articulate and intelligent. And there are some themes that run through, which is around families and being stigmatized by families, or having families with a very toxic environment. It's not easy to have a family member who's affected with substance use disorder. It takes a toll on family members, and that can lead to breakdown in relationships, breakdown in communication, and being scapegoated or being negatively affected. And this is really damaging to patients who have substance use disorders. So it's really something that we need to work on. We need to help families think about substance use disorder being a brain disease and not necessarily being a lifestyle choice. And it comes to a point where patients use drugs to avoid the negative effects of the withdrawals. So rather than being a pleasurable experience, it's actually to avoid the negative experiences, that the symptoms they get from withdrawal. I think we get revolving door patients, so they do well when they get admitted for detox or withdrawal management. They have a bit of rehab, and then when they go back out into the community, it's challenging. Many of them lost their jobs, many of them, their families, their marriages are broken down, they have children who they love. So these stresses on the brain often leads to relapses. So we do relapse prevention work, but one of the things that is missing is kind of really integrated work with families and really engaging families in treatment, which is a challenge. And I really would urge family members to try and be a bit more compassionate and understanding. It's a chronic disease. There will be relapses, unfortunately, over time, and it's about supporting your family member, your loved one, through relapses, and ensuring that they engage in pro-social activities, finding an environment at home which is supportive rather than destructive. There's one patient, he's extremely intelligent, does really well in treatment when he gets admitted, but when he goes out, often his family put a lot of negative pressure on him. One of them his sister's getting married, and he told me that his parents always blaming him, that look, because of you, our family is stigmatized and talked about, and basically pushed him into using drugs. Even patients who are not using, their family members don't trust them, and they eventually relapse because they think, what's the point? If they think that I'm using anyway, I may as well use. And this is really, really harmful. And we know that the more relapses that a person has, the worse the prognosis. So recovery is really important, the recovery coaching. So there are programs where we involve families in recovery coaching as well as patients. So I had a colleague who had 18 admissions over a 10-15 year period, and eventually he was able to get sober. So it is a continuous battle and struggle, and I really feel passionate that we need to destigmatize addiction, decriminalize it, and families are really key. All the evidence shows that family-based interventions are the most effective in terms of rehab, as well as peer support like Narcotics Anonymous, Alcoholics Anonymous. And there's often underlying issues like ADHD, depression, anxiety, post-traumatic stress disorder. So a lot of people do use drugs to get away from painful memories and painful psychological states like depression and anxiety, and even undiagnosed ADHD. So treating the underlying issue often leads to successful outcomes. But this is really a reflection on how, subhanAllah, articulate and intelligent many patients with SUDs are, substance use disorders, which is not the stereotype. And really they have a lot of strengths, and our aim as addiction professionals, in collaboration with families, is to try and get them reintegrated into society, reintegrated into becoming beneficial human beings to society and to themselves and to their families. But that needs a lot of intensive support, and often patience. So please, for those of you who are affected and those of you who have family members affected, try to increase your knowledge about addiction. There's many resources out there, and try and be more compassionate towards your family member who might be affected. Inshallah, that was helpful and beneficial. Reach out to me if you need any support. Until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.